My name is Tristan Nagget, and this is my presentation on Duane Syndrome. So we're going to go through a few questions. The first question we're going to ask is, what exactly is Duane Syndrome? Second, we're going to ask, are there any differences in Duane Syndrome? Third, what is the cause of Duane Syndrome? We're going to go into depth about the causes of Duane Syndrome, how it happens. Next, we're going to talk about the characteristics of Duane Syndrome, like how to identify it, what happens physically to you, the affected person who has Duane Syndrome. Next question we're going to ask is, who gets Duane Syndrome? What type of people are affected by it? If any specific group is affected by it. Next question we're going to ask is if Duane Syndrome is hereditary, if you can pass it on to your children, or if you have gotten it by a previous family member. And we're going to ask, when is it treated? When is Duane Syndrome treated? And lastly, we're going to ask, how successful is surgery for Duane Syndrome? So the first question we're going to ask, again, what is Duane Syndrome? Duane Syndrome is also referred to as Duane Retraction Syndrome. It's an eye movement disorder present at birth characterized by horizontal eye movement limitation and non-progressive type of strabismus due to abnormal development of the sixth cranial nerve, which is also called the abducens nerve. I'm sorry, I tried to make it interesting in the background, but that didn't happen. Yeah, go ahead, laugh. Interesting. Okay. Also referred to as the abducens nerve, a limited ability to move the eye inward toward the nose is adduction, outward toward the ear is abduction, and the last type is in both directions, both adduction and abduction. There may also be changes of eyelid position of attempted movement of the eyes. Really quick, one reason I chose to do this specific topic is I have Duane Syndrome. I have it in both my eyes. I have it in both directions. The direction that is noticed the most is when I glance to my left. Really quick, just want to show you guys what it looks like. Is right there. This eye, it closes and it doesn't nearly look as far to the left as my left eye. So Duane Syndrome was first described by Jacob Stilling in 1887 and Sigmund Turk in 1899. The condition is named Stilling-Turk-Duane syndrome, but is also known more commonly as Duane Retraction syndrome. In 1905, Alexander Duane published a landmark paper describing 54 cases in detail, including the unique features of the syndrome, of which the most prominent was the retraction of the globe and adduction. Second question, are there any different types of Duane syndrome? There are. In the previous slide was 3 types: adduction, abduction, and both. So Duane syndrome is often characterized by whether the primary abnormality is a reduced ability to turn the affected eye or eyes outward, type 1, inward, type 2, or both, type 3. Type 1 is the most common form of Duane syndrome, and affected patients will characteristically have a head turned towards the involved side and appear esotropic, cross-eyed, and a straight ahead gaze. So looking straight, say my right eye, it would go in towards the center of my face, looking in towards my nose. In type 1, about 78% of all Duane syndrome cases are type 1. About 7% of Duane syndrome cases are type 2, which is The affected eye or eyes has limited ability to move inward toward the nose, but the ability to move outward toward the ear is normal or nearly so. Type 3 is looking in both directions, adduction and abduction, looking in towards the nose or out towards the ears. About 15% of Duane syndrome cases are type 3. Now, each of these three types can be further classified into three subgroups. Subgroup A, the affected eye is turned inward toward the nose. Now, these subgroups is straight ahead gaze, where your eye drifts, if at all. Subgroup A, the eye is looking in towards the nose, looking straight ahead. Subgroup B, the eye is looking outward toward the ears when you're looking straight ahead. Subgroup C, there is no weird thing happening with your eyes. Your eyes are just normal, looking straight ahead. So I'm already 6 minutes into this. I'm going to try to hurry as fast as I can while explaining generally what everything is. Our third question, what is the cause of Duane syndrome? So Duane syndrome, it's kind of a miswiring of the nerves in your eyes. It's a miswiring in the sixth cranial nerve, the abducens nerve, the muscles in it. So technically, there is no muscle or nerve there. Sorry, I lost my place. So why the nerve doesn't develop is not fully understood. The problem is not primarily with the eye itself, like I said, but with the nerve that controls the muscle. There can also be association with miswiring of the third cranial nerve, the oculomotor nerve, which normally controls the medial rectus muscle, which is the muscle that rotates the eye in towards the nose. The sixth cranial nerve is the muscle that turns it towards the ear out. Experts also believe something happens to cause Duane syndrome between the 3rd and 8th weeks of pregnancy, which is when the baby's eyes, the eye nerves and muscles start to develop. The fourth question we're going to ask, what are the characteristics of Duane syndrome? The characteristics, strabismus, the eyes may be misaligned, which was talked about in the previous slide, the previous question. The eyes may drift towards the center of your face, may drift outward. There can also be the head position, where my head, for example, might be here, and I'm looking straight and it's comfortable for me, whereas here, and it's not comfortable for me. Amblyopia is a reduced vision in the affected eye and occurs in 10% of patients. An upshoot or downshoot is basically the same thing as a strabismus, but instead of going inward or outward, the eye goes up or down. Some people with Duane syndrome also have double vision and headaches. They might also have neck pain as a result of tilting the head. Duane syndrome doesn't cause blindness and doesn't usually lead to other health issues, but in very rare cases it has been linked to problems with bones, eyes, ears, kidneys, and the nervous system. The fifth question we're going to ask, who gets Duane syndrome? So the vast majority of cases occur spontaneously and most often only affect one eye. Around 20% of Duane syndrome patients have both eyes affected. I'm in that group. I have it in both my eyes. For reasons unknown, the left eye is more often involved than the right eye. Duane syndrome usually affects girls more than boys, which is also unknown. There's no particular race or ethnic group that is more likely to be affected. 30% of cases are associated with other anomalies present at birth. The seventh question we're going to ask is if Duane syndrome is hereditary. So, Duane syndrome, is it hereditary? Most of the time it's not hereditary. In 90% of cases, the patient has no family history of Duane syndrome. I'm in that group. Pretty obvious, it's really high percentage. So there's only 10% of patients that do have family members that are affected with Duane syndrome. It usually is hereditary when both eyes are affected. So there is a more high a higher chance that my kids could possibly have Duane syndrome, which is kind of perfectly fine. It's not that big a deal, honestly. So, seventh question: when is Duane syndrome treated? So there is no cure for Duane syndrome. For the majority of patients, Duane syndrome doesn't require surgical treatment. They can just go throughout their life normally, not really have any effect. The only reason surgery would be required is for four specific reasons. Number one, to reduce a significant deviation in normal straight ahead position. Second reason, to eliminate a significant abnormal head position. Third reason, to eliminate a significant upshoot or downshoot. And the fourth reason is to eliminate disfiguring abnormal eyelid position. So the goal of treatment is to restore satisfactory eye alignment in the straight head position, eliminate an abnormal head posture, and to prevent amblyopia, which causes a little bit of blindness. Eye muscle surgery is not always required because the function of the eye, oh my gosh, the function of the affected nerve and muscle cannot be restored. Excuse me. The other eye muscles are adjusted to compensate and allow for better eye alignment. So when you get surgery for Duane syndrome, it's not really on the affected eye, it's on the eye that's not affected. They adjust the muscles in that eye to compensate for the affected eye. Because Duane syndrome has clear symptoms, most people are diagnosed before the age of 10. The exam usually includes a close look at your eye along with a vision test and measurements of how far you can move your eye. How far you can move it to the right, how far you can move it to the left. When I have my eye checkups, my doctor will always do that with me. He tells me, keep your head still and just follow my finger, and he just brings it to the side, see how far I can move my eyes to either side. There's a gene called CHN1. It's linked to some cases of Duane syndrome. A genetic test can look for changes or a mutation in the gene that might be passed on to other family members, and that's done with just a simple blood test. So the last question we are going to ask, how successful is the surgery for Duane syndrome? So surgery can't actually fix the problem of the nerves that are miswired, but can move muscles to compensate for the miswiring, like I said previously. Because surgery cannot fix the problem of the abnormal nerves, surgery cannot restore normal eye movement. However, surgery can and usually does substantially improve the situation, but the full effect of the surgery may take some weeks to become apparent. As a kid, I've had 2 surgeries to fix this issue, and as shown, it's still here. It's still visible, but according to my parents, it has significantly helped with my eyes. So that will conclude this presentation. We have discussed what specifically is Duane syndrome, the different types of Duane syndromes and subgroups within those types. We discussed the cause of Duane syndrome, what causes it, the miswiring in the eyes, in the 6th cranial nerve, and sometimes in the 3rd cranial nerve. The characteristics of Duane syndrome, symptoms specifically, like what happens with affected patients, like head postures, sometimes a little bit of blindness, just weird positioning of the eye, who specifically gets Duane syndrome and if it's hereditary. We've talked about when it's treated and if it requires surgery and how successful these surgeries can be. I know I have gone over the time limit of 10 minutes. I'm currently at just under 15 minutes. This was actually kind of fun to make with changing the shirts out. That didn't affect my time at all. It's just Duane syndrome. It really goes into depth of what it is and what causes it. I tried to cover this as clearly as possible, but still trying to make up some time. Thank you for watching, and have a good day, evening, night, morning, whatever, and wherever you are. Thank you.